Digital acceleration is here. Health systems are walking the path, but are they in the right direction? Welcome to Patient Journey Pioneers, roadmaps from the top digital leaders in healthcare, who share insights and strategies that are pushing the patient journey to new heights. This podcast is brought to you by Hyro, and I'm your host, Liat Kozuch. Let's do it. All right, so welcome back to another episode of Patient Journey Pioneers. Today we have Bowen Wright. Having previously led Baylor, Scott & White's digital revolution, Tom is now helping pioneers in the space reimagine healthcare. Tom, it's great to have you here.
Nice to be here. Thank you.
I feel like that intro totally justifies you being a guest on this podcast, as we'll be picking your brain on all things digital patient journeys. And before we jump into the questions, Tom, let's backtrack for a sec. Your parents and grandparents were all medics, and their expectation was that you would follow their footsteps to become a doctor, which didn't happen, but other things did. Tell us a bit more about that.
Well, yeah, if there's one thing about me, I'm extremely squeamish. So I can't, if you're thinking about a movie, I just can't watch any of those gory type things. And so you can imagine like all that pressure to become a doctor, and I can't even look at an open wound. So that was a showstopper for my medical career, but I did feel like caring for the sick was in my DNA. So luckily there's lots of ways to do that.
Yeah, I also get extremely squeamish when I see the needles, so I totally feel you. So let's dive into the questions, and through that we'll learn about your journey in healthcare. What is the most important thing you're working on today when it comes to the digital patient experience?
Well, I think that just the general theme is around personalization, and I'm super excited about that topic. And there's lots of facets to that. So personalized interactions. So how do we infuse that into our communication, even call centers, but front desk, but obviously the care team and the physicians. And that obviously really enhances relationships, intimacy, which helps vulnerability, better conversations, better outcomes. But then going on that is like personalized care plans. So really being able to look at the whole person, really understand the social determinants, the preferences, as well as like the clinical markers. And so, somebody who lives by themselves, and you think about, okay, well, loneliness could be an issue. So I think about how do you infuse those into a personalized care plan? And then really thinking outside of the office, now personalized navigation, and really helping people adhere to that care plan and navigate the systems and complexities. And then lastly, if you're doing that, is really being able to like personalize your products and actually starting to design healthcare products around individuals. So that's the general theme. I think it's a very exciting one. I think we're really in the early stages, and there's just lots of opportunity there.
Mm-hmm. What is an example you can share with us kind of behind the scenes?
One area I think I'm very excited. If we think about personalized navigation, this is really where like AI and gamification can have incredible impact. So if you just think about something very simple, like medication adherence, right? You can send reminder notes to somebody at the same time every day saying, take your meds, and they're going to switch off that message like within days, right? And yet, if you can start personalizing it and really start thinking about, okay, the right message, the right person, the right channel, right time, we've seen examples where people have been on this sort of reminder system for like 3-4 years, and they really appreciate it. And if you start reducing it, they're like, hey, where are you going with it? So it just shows the power of, AI to really move the needle in healthcare in ways that we've never really thought of before. And really aligning that digital with the physical, and then empowering those care teams when you actually do need an intervention to take the right intervention at the right time. And so that's a very exciting little insight.
For those healthcare executives leading digital patient journey, what are some challenges you see yourself facing that aren't being talked about enough?
One big area that we're starting to see is that technology alone is not going to do this. Like, technology might make up 20% of the solution, but it's that other 80% that's so important. And it's hard, right? That especially health systems are very conservative corporations. You know, they've done really well by being very conservative for a long time. And so that conservatism is deep rooted. It's in the culture. It's reinforced. So if you're suddenly coming in and saying, right, we need to do a transformation, right? You guys are doing it all wrong. Hey, here's a pretty cool new tech that can do it. We just need you to change your processes and change your behaviors. That game is lost already because you're trying to do something to the organization, not with the organization. And so going from innovation to actual transformation, I think that is, for me, a big theme that people are realizing, gosh, we've got to be investing in that. And there's different types of skills. You've got to think about leadership skills. You've got to think about change management skills and communication skills. And often these things have been underinvested in places like health systems for a long time. A great example for that, my favorite product right now, it's so simple. It's eConsults, which is an asynchronous specialty consult. Very simple to say, simple to do, but to actually roll it out in your network, well, you need all your primary care docs to start thinking about, now if I have this type of question, instead of doing, a referral to a specialist, I'm actually going to get in and write the question through an eConsult. At the same time, you've got to get all your specialists to suddenly say, I've got to think and about answering these asynchronous messages, and I've got to do it in a timely fashion, and how do I fit it into my flow? And so you've got to transform your whole ecosystem. So just think about, there's a lot of technology in there, but there's a lot of process, there's a lot of behaviors, there's reimbursement implications, huge number of questions. So something very simple is actually enormously complicated to roll out scale. But, once again, if you can do that at scale, it's incredibly impactful, both for the patient as well as for the care team.
So you seem like you're doing it very well, creating change and innovation within the organization. What is one piece of advice you could give someone who is new and wants to implement a certain digital patient, project? What is your way of actually making it happen?
So I've been at this game for a long time now. And quite honestly, if I look at the first few years, very successful in innovating around healthcare, apps and websites and stuff, and very unsuccessful about innovating inside of healthcare, like doing the transformation pieces. And one of the things, really had to learn over time was around a new innovation model, a transformation model, and that idea of how do you partner with the business to drive change? And so that takes a lot of upfront thought, preparation, structure, alignment. The alignment piece is so critical. Starting with the senior executives and getting a top-down mandate, but taking the time to really lay out the future and here's our destination, and let's agree on the destination, agree on the problem statement, and then collectively let's work out how we get from current state to future state, and let's do that together. And the idea that innovation is a team sport is so powerful. And so it took a lot of getting it wrong to kind of work out, okay, we got to do things really differently. But hopefully that gives you some insight into the things that just over time have started working for us.
Tom, we're going to go from challenges to a fun little game, spice things up, and it's time to place your digital bets. I'm going to name a technology in healthcare. You tell me if it's bullish or bearish. Are you ready?
I'm ready.
All right. First one, telehealth.
Bullish.
Why?
And so if you think about when video visits first came out, we were building this new technology on all of this old architecture. And so it was really quite painful. But now as people are starting to get used to it, so if you think about my visit types and scheduling templates, now actually starting to redesign those specifically with the idea that consumers actually do want to consume often through video. It's maybe a little less than we maybe had thought at first. Like in primary care, maybe it's around 20% demand, but you kind of design your infrastructure for that outcome. And I think we were all really struggling with that. And still many people are in the depths of that struggle right today. But as people get through that and understand that, it's going to create more access and ease of use. And I do think the consumer demand is there. So I just think about my allergist. I never want to see my allergist again. Love her to bits. She's great. I just don't need to be there in person. Right. Just like, let's do it by video. But that's not an option today because of all the things I just mentioned. But so I'm pretty bullish there. Okay.
Number 2, wearables.
Wearables is a tricky one because, and once again, I think it depends on the category. So if you're thinking about a lot of this, the Fitbits of this world, I think people who want and enjoy those types of things have largely adopted them. But then I think there's some, a lot of innovation around, if you think about diabetes management and some of the insulin patches, to the extent you can make these wearables almost innocuous. I think that's powerful. Suddenly it becomes so much more convenient for the consumer. And then lastly, I would say the mobile phone as a medical device, I'm very bullish about that. I see lots and lots of opportunities, see a lot of innovation in that space. And I just think it's going to only grow.
Okay. You're being very nice today. We have bullish 2 out of 2. Number 3, conversational AI.
Once again, I'm pretty bullish on conversational AI. I think it's a remarkable time. And a lot of that, if you think about modernizing healthcare, we're going from an area where healthcare was largely episodic in how we consumed it, right? We go to the doctor, then we go home, we do self-care, 6 months, 12 months, whatever it is later, we go back to the doctor. Or now as care is moving to more this longitudinal type approach, that messaging, the messaging and communication between the care team and the patient suddenly becomes really powerful. And you've heard me mention about nudging and medication adherence. And so as messaging becomes a lot more prevalent, if you think that demand goes up, well, suddenly, are we going to hire 3 million care managers across United States to go manage all these messages and look after? No, well, they just don't exist. So the idea that AI can kind of actually provide a lot of that bridge, deflect about 95% or whatever it is of that messaging volume, well, that's really powerful so that we can create the access that the consumers want, but without the underlying costs that relates to the more traditional approaches.
Second to last one, remote patient monitoring.
Okay, well, I hate to do the thing. I'm actually very bullish on a couple of ways. So for the vendors in this space, I think the reimbursement codes massively change things. Now, I think the reimbursement codes are actually quite generous in this space. Now, it takes a little while for people to kind of work through them, design technologies and platforms. I think that we're largely there. So now if you think, hey, I'm a primary care doc and I've got a whole bunch of fee-for-service patients here, now I can kind of make an extra $10,000, $20,000 a year doing nothing, like nothing. Well, that's a pretty powerful thing. As docs kind of work that out, they're like, why am I not doing this? Now, I would suggest that like a lot of that RPM, it's designed for the coding, and so it's more optimized for the revenue than it maybe is for the outcomes. But as more and more people do it, we're going to start learning a lot more about what types of messaging actually leads to the better outcomes. But the other big force here is around direct contracting. And so now Medicare reimbursing, primary care docs directly for managing, total cost of care. Well, then now we've got beautiful alignment between payer, patient, and provider. And unquestionably, remote patient monitoring is a powerful force in reducing total cost of care. And so that's where I see like a lot of innovation happening. And once again, we get moving away from process metrics and more to like outcomes and also clinical outcomes. That once again, I've seen some remarkable changes where you take I mentioned medication adherence, a clinically non-adherent population, and then through remote monitoring, within 6 months, that like 95% plus adherent, and you've seen like total cost of care really coming down, H1C coming down, weight coming down. It's remarkable. So that is a space where I'm really jazzed, and I think we're going to see some amazing outcomes.
Let's see if we get a 5 out of 5 from you here. The last one is augmented reality.
Oh, wah, wah.
Wah, wah, wah.
I would love to get excited by it.
Almost 5 out of 5.
Contrarian here. I think there's more hype than anything else. And just a little bit of context, I spent 3 years in my early 20s in sort of 3D visualization, and I got a lot of scars from that time. So I know I've spoken to a few VCs recently, and they're all excited about it, but I don't know. I just don't get it.
So we're going to go bearish on this one.
I'm going to be a bear.
All right. You were almost 5 out of 5, but then right at the last minute. All right. That's okay. Experts got to say what they feel. All right, Tom. So question number 4. Now that we discussed some emerging technologies, what are some technologies that are on your wish list when it comes to digital patient engagement? What do you wish to see one day?
Well, rather than like reaching too far out in the future, and I'm going to play something in the area that's relevant to you around conversational AI. So one of the challenges about delivering a great patient experience is suddenly patients start using a lot of these tools. And one of the tools I mentioned about is like this messaging tool. And we've seen, I think it was a McKinsey number in the last couple of years, the use and adoption of like in-basket messaging has tripled. So, and I see my wife, she's just like, oh, I've got all these questions. So rather than calling, doing the traditional thing, let's call the call center and let's see what they are. So, I'm just going to message my doc. I get an answer back within 20, 30 minutes. Well, yeah, it's great for the consumer, but now suddenly that care team is suddenly removing a lot of that administrative burden onto people who are already totally burnt out. And so unless you can kind of think proactively about how do we remove that burden from the care team, like honestly, like in-basket messaging will be the death of digital health, because there isn't the time or the will to take on all that burden. So, I see a lot of innovation going on the website side, on the IVR side, in the call center. I really want to challenge people to productize a front end to the in-basket messaging that can really defer a lot of that burden and remove it from the care team. It's also kind of giving a like speed to answer. Yeah, it's great getting an answer back in half an hour. It's even better if you get an answer back within 10 seconds, right? So I'm going to lay down the gauntlet for the industry there because you'll be solving multiple problems.
In 10 years from now, Tom, how do you envision a hallway conversation taking place between two healthcare CIOs? What are they talking about?
Oh, gosh. The next few years, it's around getting the foundations in place. And then very quickly, I think this personalization piece is going to take off. 10 years, that's a lot of opportunity. So I think if you look at the pace, the area is really around aligning the incentives and the technology. And so it's this whole idea of payers fighting with providers and who owns the patient, who gets to navigate the patient. I'm really hoping that will have been solved in the next 10 years. And so we can really start saying is, this specific type of patient, how do we truly deliver the best care experience that leads to the best outcomes? And, once again, now bringing like pharma into that as well. And so all the innovation players have their incentives truly aligned to solve the problems for our communities. That's an exciting spot. I think we can get there in 10 years.
So, Tom, as we wind down towards the end of our interview, we'll go into just a few personal questions. How do you envision your future self in healthcare specifically?
I'll tell you where I'm excited to play is the forefront of where payment innovation meets technology innovation.
Interesting.
And I'm really excited about, some of these new payment models coming out. We're starting to see, payers give more conscientious providers more risk. We're starting to see the direct contracting around Medicare. I think finally, as we properly align incentives, it empowers all these new business models that in a fee-for-service world just don't work. But in a truly value-centered environment can be very powerful and great for the patient. And so that is where I want to be innovating myself.
Well, I hope to have you here in 5 years from now telling us some of your success stories. Who would you nominate as a future guest who is a trailblazer in the industry making an impact?
Yeah, I do have somebody he was one of my partners in crime back at Baylor, a guy by the name of Dr. Ashish Barad. And he is now, very recently, he's taken on the Chief Digital Officer role over at Allegheny Health Network in Pittsburgh, great little system. And he's a great friend. We got to kind of partner together on that eConsults rollout where he was like the clinical lead. And it was, just great experience. And he is a very interesting character, a very charismatic leader. And I just think you would have a lot of fun with him.
Tom, I want to thank you so much for your insights. I really enjoyed this conversation with you.
Oh, likewise. You take care. Thank you, Nick.
Thanks.
Thank you for listening to Patient Journey Pioneers, brought to you by Hyro. Subscribe to our podcast on your favorite listening platform. See you on our next episode.